New data is showing the healthiest and unhealthiest counties across the country, and the rating looks at more than 30 factors, including gender equity, child care, affordability, and jobs.
And Sheri Johnson is the Population Health Institute Director at the University of Wisconsin, here with a closer look at the quality of life here in our state. Good morning.
Good morning.
Good morning.
So this year, the country was grappling with another year of our pandemic. Let's look at where SoCal counties rank on the list.
Right. So what we do is rank nearly every county in the United States according to a model of health that looks at many factors that drive how long and how well we live. Things like income and education and family and social support. And so in the state of California, the county that ranked the highest was Marin County, and the county that ranked the lowest was Trinity County. And we know even in high-ranking counties, though, that there's always still more work to do to make sure that everybody has the resources that they need to live long and well.
And Sheri, we do want to point out that Ventura and Orange County are in the top 10 as well. Los Angeles is somewhere in the middle at number 28. And you talked about Marin County being at number 1. Why does this county top the list?
So our model really emphasizes that those social and economic conditions are really important drivers of how long and how well we live. And so this year we focused on economic security in particular as we come out of this pandemic and look forward to a just recovery. So we looked at things like child care cost affordability, the gender pay gap, the importance of living wage, for all of us to be able to thrive and to meet our basic needs with dignity.
And can we talk about the problems with access to health in some vulnerable communities?
So the model really emphasizes that in addition to access to health care, these other factors like, for example, child care cost burden are really important. So in LA, the average child care cost is about 29% of the income of an adult with 2 children. The federal government suggests that we pay about 7% of our income. So that's a pretty big gap between what the federal government recommends and what an average adult in LA County is paying. So it's really important then to think about what are the system level changes that we need to put in place to make sure that childcare is affordable and accessible so that parents and caregivers can go to work, can contribute to the local economy, can have that sense of confidence that their children are in a place where they're on a strong start to a long and healthy life. So what those system level changes include things like publicly funded pre-K. That is one of the solutions that we offer in this year's report.
So Sheri, how can state and local leaders use this information to help formulate and implement policy changes to help residents lead healthier lives?
Exactly. We have about 400 plus strategies in our database, and it's important for not just elected local and state leaders, but residents on the ground who really know about these conditions from their own lived experience. And it's about everybody getting to the table to say, what can we do and what are we going to prioritize? You can look at your county snapshot and look at strengths and weaknesses and then really go from there to take action.
Well, Sheri Johnson, thank you so much for joining us.
Thank you so much. And Sheri, what part of Wisconsin are you in? Are you in Madison or Milwaukee?
University of Wisconsin is in Madison, and I am a Milwaukee person.
Oh, I used to live in Milwaukee. Okay,
Really?
good to see you. Yes, ma'am. All right, enjoy yourself and enjoy your 1 or 2 months of summer. Have a good one, and thanks for being on.
Thank you.
Of course.
Go to countyhealthrankings.org.
You got it.
Great.